Breast Cancer Awareness Month is coming to a close, and this morning a different kind of cancer is becoming more common in men.
Yeah, that's right. So joining us this morning is 9 News medical expert Dr. Kohli with more on gynecomastia. Did I say that right?
Perfect. You
okay.
said perfect.
Well, because we're learning so much more about this, because like Corey said, this is becoming more common, specifically in men. What are the symptoms that we see of this?
So gynecomastia is a medical term for essentially breast tissue that's enlarging in men. Oh. And, if you think about, what a man has inside his breast, it's the same components that a woman has. It's fat and it's glandular tissue. And gynecomastia is pretty common, actually can happen in 30 to 50% of healthy men. But it's important to know your breast tissue as a man so that you know if there are changes that happen, what's causing it. And certainly can present painless, but it can also present with a lump. It can be painful. There can even be nipple discharge in men as well.
When do you know it's time to go to a doctor?
Yeah, so if you see any of those warning signs, so think about the fat and the glandular tissue. So what causes gynecomastia? If you put on a lot of weight, there's more fat. So that can change the contour and the shape of the breast. That can usually be benign, and it's usually symmetrical. It's usually painless, and the breast tissue can have a different shape. You lose the weight, that goes away. However, breast cancer, 1% of breast cancer is male breast cancer. So if you feel a lump, if you feel anything hard, if you see any skin changes or retraction, certainly any kind of asymmetry, that's a sign you need to see a doctor. A brain tumor, which can release the hormone called prolactin, which causes women to lactate, can cause men to start lactating because they have that same milk duct tissue, and the glandular tissue. So any kind of lactation or discharge from the nipple, especially if it's bloody discharge, is a sign as well. And then painful gynecomastia, if you're having breast tenderness, that's usually a sign that the glandular tissue is changing because that's hormone sensitive tissue. Sometimes that can be benign, but that's a sign you usually should get it checked out.
I'm so glad we're talking about this. We had Murphy Houston on recently who was talking about breast cancer in men. And I think the big problem there is that's something that a lot of men maybe don't feel so comfortable to share with their doctors.
Not just share, but we don't screen men systematically, right? We know that men can have a lot of the same risk factors. I actually lost a dear friend in medical school to male breast cancer. He was a surgeon, he was operating, and he started having arm pain, and he thought it was carpal tunnel. And it was actually breast cancer that had spread to the lymph nodes. So certainly men should firstly feel comfortable feeling their breasts once a month or so, just knowing what it's supposed to look like, looking at it in the mirror, and again, noticing any asymmetry or lumps or masses or any tenderness that feels abnormal. But secondly, and more importantly, gynecomastia, which is much more common than male breast cancer, it needs to be normalized.
Yeah.
Men are embarrassed. Men wear baggy shirts. Men think that something is wrong with them if they're developing these man boobs. And in fact, during puberty, 2/3 of boys can have gynecomastia. So even talking to your adolescent boys about it could be normal to have these kind of breast changes because when the balance between testosterone and estrogen changes, whether it's in puberty or whether it's later in life when men are going through this called menopause, when their testosterone goes down, you can have gynecomastia, but talking about it, at least with your doctor, if you're not comfortable talking about it with your partner, is really important.
Yeah, you have to be your own advocate, know what feels right, what doesn't. So
and you can treat it if you catch it early.
Right.
Because a lot of times gynecomastia becomes irreversible if you don't take away the offending medicine. We know alcohol, we know marijuana, all these things can cause gynecomastia. So addressing it with your doctor early so you can make it better.
Dr. Kohli, thank you so much. We appreciate it. This